Lab experts. Today we're here with Ponzing Josiah, a veterinary medicine student currently, who is going to talk to us a little bit about why he has an interest in the laboratory sciences and also why the laboratory sciences are important to the field of veterinary medicine. But before we get to that, how are you today, Josiah?
I'm great.
It's nice to meet you.
Thank you very much.
So, veterinary medicine. It's rare to find someone that's studying veterinary medicine. I can say actually that you're like the second person I have known that told me that they study veterinary medicine. Well, I've known some veterinary doctors here in the past, but I've never actually seen someone that studies the field. So why is it a field that interests you? What took you to that field?
Okay, medicine is a unique field. It's somewhere that you can actually have a direct link to the health system, and also a field that gives you an opportunity to be able to explore your environment. From reports, about 75% of human diseases are actually from animals. Talking about zoonotic diseases now.
Yeah.
And so from there, I think on the concept of One Health, for instance, we have a part that we also play as veterinarians. And so for me, it interests me so much that I can be able to offer my best to the health system towards the side of treatment in animals. And, and not just treatment, to be able to proffer solutions in terms of even prevention, developing certain drug therapies and certain treatment regimens also that can be able to help in the treatment of animals. And then for me, I think I got into veterinary medicine. Let me see, I didn't really apply for it. Yes, I applied for human medicine instead. But as how God would do it, I got into veterinary medicine. And when I got there, I began asking myself questions about, okay, it was not really as if it was my first passion. And so I need to do this. So one thing I've learned in life is I'll need to discover the purpose behind something in order to do it well. Because I don't want to be a person running just with trying to get great, cram, passing, and just do well at it and just do anything and that's all. I want to be excellent at it. And so excellence now led me into asking questions and knowing why the field of veterinary medicine is there. And so with my little inquiry and discovery, I got to understand that there is so much that field had to offer. And then certain even treatment regimens and certain surgeries in humans now, they were actually gotten from animals. It was a bit like a trial in animals, and then the human medics adopted it, and then is working perfectly. And so I tried to also link it to the human health, for instance, that there's something I can do in veterinary medicine that can affect the whole health system. So I hold on to it dearly, from my anatomy to my physiology, which I'm very interested in, and the field in which I'm trusting to really explore it very well is also there. And then seeing that certain opportunities still abound in it, and that I can really have an opportunity to be able to participate in certain research work and doing certain things like that that can be able to help both animals and also humans, and then the environment entirely.
Yeah, you're right. The last year's COVID-19 is actually a very good example of how animal health and human health are inextricably linked. Lots of the pandemics that we've had in some of the recent years, we can see that at one point or another, we sort of traced back an origin to an animal or potentially, usually an animal vector. So it's true that it's very important and it's very linked in that particular sense. Now, you talked a bit about research. Are you currently involved in any sort of research? Or is there any particular kind of research you are interested in, or it's just something that you'd like to get into eventually?
Currently, I'm not into any research yet, but I'm looking into antimicrobial resistance, into clinical pharmacology, as biomedical sciences. I actually see a connection between these fields. Yeah, that's what I'm trying to look into it, developing better drug therapies like that. Yeah.
Mm-hmm. So let's say me or someone else who's watching this as a medical laboratory scientist who would like to, say, lend a hand to veterinary doctors that are out there. how could they help? Apart from, so I guess already on the research side, that's one thing. Now, as a veterinary doctor, what are some of the tests that the lab can actually help with?
All right. I'll go back to, okay, we run certain tests like that on samples we get in the laboratory, ranging from tissue processing to blood testing, trying to see the PCV, and also running smears to try to identify certain disease causing organisms like that. And also, you heard of PCR, polymerase chain reaction. Yes, even going down to that level like that. This is one way any medical laboratory scientist can actually help in this particular field. Now, Louis Pasteur said something. He said that without labs, science is like science is like soldiers without arms. And also there is another quote again that without laboratory, we are only guessing.
Yeah.
So since in the field of veterinary medicine, you observe through that, of course, these are biological beings and these are living beings. And so getting certain samples from them is coming to actually a place of trying to identify the exact cause, is trying to know what is the problem. And so we cannot leave the field of medical laboratory science outside diagnosis and treatment. They are very important because even with the rise in microbial resistance, for instance, one of the causes I got to identify is that the etiology was not determined very carefully. And so the wrong drug treatment was actually given. And at the end, the bacteria, they were able to change the variant surface glycoprotein to another form that an antibiotic was administered and then it couldn't actually work again.
I see. And from what you said, from your explanation, I can see that there seems to be a lot of overlap between what's done in a medical laboratory and what would probably be done in a veterinary laboratory. So it seems like the skills are very transferable. The same skills you use in one area are the skills you can use in another area. So potentially some of the medical scientists with a little bit of training could be able to adapt, switch over to veterinary and also help in that area. Now, but like I was saying at the beginning, it's when, for some reason, when I started talking to you that I realized that I don't really know people that are involved in veterinary medicine. So I'm guessing it may not be as popular. It's how do you get people interested in the field? Like, what are some of the things that are being done to interest people, like maybe medical laboratory scientists who may already have some of the skills that you may want, let's say to help you as a veterinary doctor in the lab, but don't necessarily think of working in a veterinary laboratory as something that is doable, as something that's viable? Are there some initiatives out there to kind of bring some of us over to help you out?
Earlier I spoke about One Health, and One Health advocacy is bringing, is overlapping the environment with human medical side and then the animal medical side, you understand?
Yeah.
So it's like a collaboration of these professionals coming together to be able to treat a particular problem affecting the society. Because you know that the society has the people, the animals, and their immediate environment, do you understand, about the plants and everything. So in one way or the other, human activities affect animals. Animal activities also affect humans and also affect their environment. So sometimes it's just it might not really be because of a direct contact, for instance, but due to the animal activities, for instance, is able to leave a particular problem in the environment. And because the humans interact with the environment, they pick that up and it becomes a problem. One Health initiative is another thing that is actually working greatly, even in universities and also professional bodies taking this up so that the professionals can actually work together. And if you observe trees, as if everybody has just been on his or her own. The environment scientists are just there on their own. The human medical professionals, they are just there on their own, and the veterinary professionals, they are just there on their own. But even from my explanation on zoonotic disease, when I was talking about 75% of human diseases from animals, you observe that if the veterinary professionals are not there, for instance, you might not be able to know the pathophysiology of a particular disease, for instance. You might not be able to know how it developed in animals enough for you to even try to bring the treatment regimen in humans that are affected. And also at our undergraduate level, yeah, they are doing much of this advocacy, like associations, for instance. Then we have
Okay.
different national and local associations that try to enlighten the students on what to do. And even now, I think last week I attended a seminar on this particular issue, how we can actually collaborate together to bring in more solutions as a whole, not just as a part, because even to the veterinary side, there is still insufficiency. Even to the medical side, there is still insufficiency. And to the medical laboratory scientists, I would like to say this. I believe that as a scientist in that particular field, you are trained to look into the health system to be able to identify a problem and provide a solution to it. And so an opportunity can come this way, that if not directly to the human side, there's something that actually eventually affects the humans. So getting into it might indirectly mean that I'm also contributing my quota to the human medical profession. That way, you can be able to see that although I might not get directly to work with humans, I have something I can actually do. Let's say in terms of zoonotic diseases, for instance, that can be able to help the animals and also help the humans. Because now the trend of everything is for us to come to a level where the environment is free of diseases, the environment is free of any harm, the animals are free of any disease conditions that affect the humans, and the humans are also free of disease conditions that affect the animals. So it's a collaborative work which is working effectively now to be able to cope some of these problems. You observe through that, like in the issue of antimicrobial resistance that I spoke about earlier. This identification of some of these bacteria is not as if they are just uniquely animals all the time. Of course, there are unique disease-causing organisms in animals, and also there are unique disease-causing organisms in humans. But your expertise and your skills can actually also be employed in the veterinary profession, because it works actually somehow in the same manner. It's not as if because you did it in you did tissue processing, let's say in humans, for instance, then you come to animals, then there's a unique way that is being done like that. I remember here at the research institute in Plateau State here, I was there for an industrial attachment, and we observed some of the equipment is the same. We even have there are also human medical professionals that even come around to be able to carry certain tests like that in a veterinary establishment. So it's still collaborative. Yeah. It's still something that you can actually work towards it to see that at the end of the day, everyone is free of whatever thing that is harmful from the animals, from the humans, and even from them to the environment and to the animals.
Yes, we need to work a lot more together, like you were saying, because a lot of the equipment is actually equipment that could be shared between those laboratories. And so you could use the same sort of equipment to help in both areas, which of course is going to be extremely valuable if we can get to work together a lot better and in a more efficient manner. Now, you also said that you were a mentorship manager. What does that entail?
Okay. In IVAS, that's the International Veterinary Students Association. We have standing committees. So I am a member of the standing committee on veterinary education. So I'm part of the committee, like the ESCOs, the officials. So the mentorship, being a mentorship manager, what I do basically is I try to promote the value of the Standing Committee on Veterinary Education, which is to be able to allow the dissemination of information from veterinary professionals to the veterinary students. So we created a platform which is mentorship. So from there, I'm able to manage I'm able to manage the flow of information from the professionals to the students. So from the platform we created, I in particular, we work together with the national coordinators to ensure that the students who applied for the mentorship program are spread across different fields of veterinary medicine. So from there, we identify veterinary professionals that are already experts in those fields, having more insight and understanding and the career pathway towards those particular fields. And so you know that one of the effective means of learning is that you have someone that knows better than you teaching you. So we believe that strongly also. And as a mentorship manager, I work so that I can be able to make the students to come to a place higher than they, to come to a place that they can just see beyond the veterinary, just beyond the walls of the veterinary school. They should be able to see beyond that. They should be able to see what opportunities that holds for them beyond veterinary school. So that at the end of the day, they shouldn't be confused on what to eventually venture into after leaving veterinary school, because it's important that way. We have, of course, a lot of professionals, even some people getting confused on the areas they want to specialize in after veterinary school. And so they end up going with anything that just come to mind. Of course, there's nothing wrong really with anything, but you should know that you're a unique individual and not anything just works for you. And so that's what I also do, so that you can be able to identify what particular field interests you, and then you can start the career pathway. Even since when you're in your second year or your third year, you identify it and then you're working towards it already.
Interestingly, as you're talking about that, I was wondering whether it wouldn't be an approach that would also be important to adapt for us in the medical laboratory science field, because many people in the medical laboratory science field also feel the same way. After they are done with their studies, they don't necessarily know in what direction to go, in what direction to actually specialize. So it's actually really nice that you are able to do that and have a collection of students that can actually, and it's always better when you are with a group of like-minded individuals, and then you all know in what direction, what general direction you are going. And as you are talking to each other, new ideas come through, you can make better decisions, and then the field, of course, can be better as a result of all of that. Now, talking about veterinary, the veterinary side also in a little bit more detail, what are some of the problems that you face in the field? When I say problems, what are some of the major diseases that are problematic in that field?
We have the case of rabies. It's actually one of the major disease conditions that we faced here, because it doesn't just affect the animals. Of course, rabies is zoonotic. It also affects humans. And also we have in chickens, for instance, the issue of fowl typhoid, fowl cholera, Newcastle, Gomboro, and then we also have the conditions of there's PPR that we call pes des petits ruminants. It affects actually small ruminants, basically. And then of course there's also sheep pox, goat pox, and also I think it has been eradicated now. It has been eradicated completely now. The issue of rinderpest, which led to even the establishment of a veterinary research institute here in Nigeria, specifically in Jos here. So these are some of the challenges we face here in the profession, because also brucellosis, some of these things, even in treatment, as you're treating the animals, you have to be very careful about yourself also. It's not something that you just feel as if you're an expert in it and then you just dive into it like that. Sure. And one thing we're particular about is zoonotic diseases. Even you're a vet, you're a human being, you're not an animal. And so in treatment, veterinarians are very careful about this. Because I had an issue recently. A veterinarian was treating an animal with brucellosis. He was not really very careful about it, and that's how he was infected. He never knew it was towards the tail end, when the clinical signs are blown already, like we are there. We will cover it, and it was really late. That's how he died. And also the issue of there is this veterinary professional. She had an encounter with a rabid dog, and that's how it affected her. I don't know. She didn't go for any exposure prophylaxis like that, and that's how the whole affected her. She died back in. You understand all these things. So these are some of the disease conditions we face in the field, and particularly about zoonotic diseases because it actually affects you. There are some of them that they don't really affect that. It doesn't really affect you like that. But we're particular about this ones also. But it's not that we are selfish people. The veterinarians are some sort of selfish people that are just concerned about zoonotic diseases alone. No, we're particular about these animals. That's why I had to mention to you some of the disease conditions that are not really affecting humans also, because we about the 5 freedoms of animal welfare. We believe in the freedom of animals from any disease condition, so we work effectively towards that. Yeah.
Speaking of rabies specifically, someone is watching this and wants to protect themselves from that disease. What are they supposed to do? What are some preventive measures they could take? And if ever they get in contact with an animal that could be infected, what should they do?
Now, what you first do in identifying any rabies dog is for you to isolate it. If it's possible, go ahead and isolate the dog. If you cannot be able to, because of animal restraint method like that and because of fear, make sure you identify a veterinary professional in your area or anywhere to come help you restrain. It's very important. That's the first
What are
part.
some of the symptoms? How, if there's a dog here, for example, how would I know that it's a rabid dog? What are some of the things that I should look out for?
Okay, what happened is, of course, you begin to there are actually two forms. There are actually two forms of rabies, but generally, what you begin to observe is there's this incoordination. There's this nervous incoordination that yes, and then you begin to feel feverish. Of course, weakness is there, and it has gone to the terminal end. You see a person begins to back because of the nervous incoordination. Yeah, you cannot be able to coordinate your movement like that, and of course,
but I mean in the animal. So let's say there's an animal around, right? Let's say I'm in a house, and let's say there's a dog. What are some of the signs that I could be looking for to know that something might be wrong?
Yes.
And maybe I should call a doctor.
Yeah, look out for, as I said earlier, you look out for nervous incoordination. Just observe the movement of the dog. You can observe frequent muscle twitch like that. And then secondly, you observe that the dog begins to form, like it begins to bring out saliva at an unusual quantity like that. I think especially that sign is very, very important. And then the dog wants to be biting. It wants to bite anything outside. It wants to be biting anything outside. Yeah, look out for those signs.
Okay, I see. Yeah, I think those are signs that people would probably be happy to know about in case they have that problem someday. Now, as you were talking about the pox viruses a bit earlier, I couldn't help but think about monkeypox. Was that ever a problem do you have any idea, in Nigeria? Is it something that's recurrent, that happens often, or what's the state of that disease over there? Any ideas?
Yeah, yes, not very much though. We had with the outbreak, we had a seminar recently. It's not really something that we observe frequently. In fact, for the past, I think throughout this year, even for the past 2 years, we just heard about it, and then a seminar was brought up to be able to give a little enlightenment about that. So it's not something that occurs recurrently here in Nigeria. No. Yeah.
All right, that's good to know. So Nigeria is a place I can go and stay if I want to run away from monkeypox. Yeah, I know, not necessarily, but it's at least nice. So, Josiah, thanks a lot for taking the time to talk to us today a bit about your field and a bit about how the laboratory could, and even medical laboratory scientists could help out a little bit in the field. I think this would have opened up the minds of some people who are in the medical laboratory science field and who, for one reason or another, may want to branch out a little bit, may want to learn a little more, may want to learn new things, may want to help in different areas while still ensuring that we as human beings, as well as animals, also have better health. Are there any last words that you'd like to share?
This platform, this podcast is a platform for for education. And so I believe education is the enlightenment of the mind. And so through continual engagement of knowledge and information, we can come to a place of knowing what we should do and how to do it. This is very important to the development of any course, any career, and anything at all, because it's important for a person to be truly educated. So I advocate for knowing what you're doing, not just trying to, like in terms of the educational sector, not just trying to cram and pass and not know what you are actually doing. I advocate for knowing in depth what you're doing and trying to find opportunities in what you're doing and be able to walk through it to solving a particular problem in the society. So relating it, of course, to this podcast, I think it is one way to go about disseminating information to people that are really concerned about information and about what they need to be able to do well in their career. And there's also an exposure to veterinary professionals and anybody in the society at all, because this thing does not really affect only the health professionals. The health professionals are only a part of the population trying to identify a problem and solve the problem for the whole people. So it's important. Yeah. This is important for everybody. So it's not just for the health professionals. It's a good work. It's a good work.
Thank you.
And I also, as I stated earlier, I also advocate for mentorship. I currently am in a mentorship program. I try as much as I can to learn from people that have gone ahead of me. And so it's an advice to everyone that is listening to this podcast also. Try to get someone that has gone beyond you to teach you something. Pay the price for that career, pay the price for that course, pay the price for that initiative. It's going to be worth it. Thank you.
So lab experts, thanks a lot for being here with us today. You heard it. We need to not only be professional learners, but also become professional problem solvers and start looking around us for the problems that are around us and how we could actually help solve those problems. And that comes through ensuring that we have the knowledge of the problems, that we keep on learning and that we keep on advancing in our careers. Thanks a lot for being here with us today. And we see you next time to talk more MedLab.